Hello to the viewers of New Indian Express. Here we are going to discuss about the black fungus or mucormycosis, which is being spoken about in the country in the last 2 weeks. It is also a notified disease in many of the states, and a lot of deaths happened because of this fungal disease has also been reportedly associated with it. So now we have Dr. Ashwin Karappan, internal medicine doctor specialist at Gleneagles Global Health City in Chennai, who will explain to us about the black fungus which is being spoken about now, and also he'll be in detail telling us what is this disease about, how it is related to COVID-19, what is the mortality rate of this disease, and many other things. Let us go into the interview. Hello, doctor. Thank you for joining us. Doctor, I'd start with basics of what are the characteristics of black fungus or mucormycosis, and what are the symptoms that the patients initially present when they get this fungal infection?
See, mucormycosis is basically a fungal infection, which is not only being now or discovered now. It has been discovered in the earlier stages itself in many other conditions where you have uncontrolled diabetes, you have immunocompromised patients, you have patients who are on chemotherapy who have low immunity status, you have patients who are on, some kind of steroids and drugs, including rheumatoid arthritis and other drugs which suppresses your immune system, and then in solid organ transplants. So all these patients have a potential of getting mucormycosis, which has been treated over a period of years with Ampho-B, amphotericin B, and posaconazole, isaconazole, most of the antifungal agents. Now we see there is a huge outbreak of this mucormycosis. It's a non-contagious disease, and it is most likely from the industrial oxygen or from a source which is unknown at this particular moment, where people are trying to find out and figure out where this mucormycosis actually is coming, especially when it comes to COVID-related patients. So COVID patients who are treated with high doses of steroid, who have prolonged illnesses, who have uncontrolled diabetes after treatment with steroids, are found to have mucormycosis, and the mucormycosis basically spreads through the air through the spores which gets deposited into your sinus. That is the route of entry when it comes to mucormycosis. So even the symptoms, you can see that most of these symptoms are related to the sinus and the face areas. So when the spores enter your nostrils and then it produces the mucor infection, probably you can have swelling of your face, you can have swelling of your eyes, one side of the nostrils can get blocked or both the nostrils can block. You can have a brownish color discharge or a black color discharge, which can be seen from one of the nostrils or both of the nostrils. Sometimes you tend to sniff it and then you tend to spit it out. That can also cause this kind of problems. You can have low grade of fever, which can be there. And most commonest symptoms is the redness of the face. So all this can be associated with mucormycosis, and especially with the history where you have a previously treated COVID infection, or you have a nasal oxygen which is being given to you with uncontrolled diabetic patients, then you should suspect mucormycosis, especially when there is an endemic outbreak. And that is the reason most of the states have identified this as an endemic and they have made it as a notifiable disease.
Doctor, moving forward, you said this is because of steroid use, it's partially because of that, and also COVID patients are susceptible to it. Is it because of the immunosuppression that is happening due to steroid treatment that people are susceptible to this fungal disease?
See, when you give steroids, naturally you're reducing the inflammation and the immunity of the body, because the basic pathology of COVID-19 is that after the 7 days of the initial infection, the virus causes a cytokine storm which is actually destroying the lungs and thereby leading to severe disease. So that is the reason why steroids were introduced. So steroids definitely play a role where it suppresses your immunity. And we also know that steroid is a drug which will increase your blood sugars to a larger extent. People who have 200, 300 can have up to 500 and 600 uncontrolled diabetes when you give steroids, and that also contributes as a factor. So both these therapies, which includes you have a steroid and an uncontrolled diabetes, where you are completely immunodeficient, this problem arises, and that is the main cause of mucormycosis outbreak, and that is what makes the patient susceptible to these diseases.
In the first wave, we did not report mucormycosis this much across the country. And in the second wave, it is now a notified disease. How did this fungal infection play out differently in the second wave than the first wave, in your opinion?
See, the first wave, we gave a lot of steroids, but still patient did not get mucormycosis. That is partially because we did not have insufficient oxygen, and we did not look into other parts of where the oxygen is being produced, like the industrial oxygen which we are using. We need to really suspect the source. If you do not have the source in the air or anywhere within the hospital, there is no way these patients are going to get mucormycosis. So basically, the source needs to be identified. Why there was an outbreak, and from where did it all start? Is it the impurity of the industrial oxygen? Is it the old cylinders which are being used for giving oxygen to these patients? All these is a huge question which stands before us. Because unless and until you find the source of infection, it is very difficult for us to control the infection and the spread of it. So what I basically believe is that we have used a lot of oxygen and a lot of drugs which have not been used previously in the first wave. And that is one of the reasons why there is a huge outbreak of mucormycosis. And apart from which, the double mutation strain, especially the B1617 itself, has been a very virulent strain which attacks a young individual. And I think that is one of the major reasons why there is a difference between the first wave and the second wave.
What is the percentage of mortality for mucormycosis? Because in Maharashtra, we have recorded close to 100 deaths. And every other state is recording here and there some deaths. So what is the overall mortality rate for this fungal infection?
See, the normal mucormycosis, when it is in the most advanced stage, the mortality is almost 80 to 90%. That makes the death impossible. And, many people die because of that, because they present at the later stages in the B3 or 3D, those kind of stages where they present, where there is an involvement of your paranasal sinuses, it is involvement of your palate, then you have an involvement of your eyeballs, and then and the brain, where it has entered the brain. All these needs extensive resection. That means the entire portion which has been affected need to be removed, and that makes the patient more vulnerable towards the mortality side. And that is the reason why the mortality is very high even in treated mucormycosis, and especially the drugs which are used, why mucormycosis has a very high mortality rate.
And you earlier said this affects the sinus and it starts from there. Does it move to other parts of the body? Which all body parts which it can affect?
See, mucormycosis can affect any part of the body. It can affect your eardrum, it can affect your lungs, it can affect your eyes, it can affect your intestine. So it can affect any part of your body, including your skin. So mucormycosis does not necessarily mean it's only going to affect your paranasal sinuses and your face. It can affect any part of your body, and we have been living with this fungus and has been successfully treating when it is in a milder form. Only when it gets close to your brain and your eyes and the orbits and face, where we call the dangerous area, it becomes difficult for us to treat. But we have been successfully treating these diseases in solid lung transplant patients. And we have also seen many organ transplants, solid organ transplant patients also been successfully treated by 4 to 6 weeks of therapy. So it depends upon which stage you identify. The earlier the diagnosis is made and treated, the better the outcomes are.
Does this only affect comorbid people or those in immunosuppression, or even healthy young individuals are also susceptible to it?
Usually the people with comorbid condition where they have an uncontrolled diabetes are the ones which are primarily affected. But the healthy individual who has undergone COVID treatment or who have gone some kind of immunosuppression can also get mucormycosis. But most likely It is only affecting the people who have comorbidities and not the healthy individuals.
And now the drug, we'll go to the drug which is used to treat mucormycosis. And as the demand goes up, the drug amphotericin B, many people are making requests on Twitter, social media. It is not available. Across India, they are asking for help. So what is the time duration this drug needs to be administered to a patient when he gets this infection?
See, when these patients are diagnosed with this kind of infection, where it is involving the CNS, brain, eyes, and many other places of the body, it is usually given from 4 weeks to 6 weeks. The earlier, the better. But we need to see the tolerance of these drugs, because these drugs can affect the kidneys, they can affect any part of the body and cause serious side effects than the disease itself. So we need to choose the right patient. And then these drugs are also quite expensive drugs, where you have starting from 7,000 all the way, it goes up to 8,000, 9,000 for a while. And so it is also going to be quite expensive treatment, and even extensive resection is also going to be quite expensive. So the key is the early finding. Anyone who is post-COVID infection, who has uncontrolled diabetes, who have a suspicious of facial swelling, fever, or any kind of mucor-related symptoms, you need to consult your specialist immediately, so that we identify it in an early stage and we can always titre and taper it for less than 2 weeks, or the maximum duration can go up to 6 to 8 weeks.
Doctor, in case if a healthy individual comes early for diagnosis, what is the duration of treatment an average individual gets for this fungal disease?
Usually it is around 6 to 8 weeks, and that should be more than sufficient for the therapy. Sometimes it can go up to 6 months. So it depends upon how invading the fungus is and how the patient who is having the disease is susceptible, and his immunity status, how bad it is or how better it's going to work towards these funguses. And that's what is going to make the treatment possibly right. And we keep the patients, once they complete the therapy, we do a PET scan and then look for any other places where these lesions are there. And if there are no lesions, then we stop the therapy. But usually minimum of 6 to 8 weeks needs to be given to the patient.
And now moving forward to the public health surveillance system, now back-to-back outbreaks we are getting. With first was COVID-19, and now this fungal infection, black fungus, is spreading everywhere. What should the public health surveillance system do, and how it can improve to monitor all these new age or diseases that have already existed but becoming a outbreak? And what can be done to monitor this and to make ourselves as a state be prepared to tackle these kind of new age diseases?
What I would suggest is first identifying where this started, or what is the source of the infection. That needs to be cleanly defined and found out, whether it's from the industrial oxygen or from the older pipelines from the hospital, or how does it actually come. Because it's not a contagious disease, it's basically being spreading through some mode or somewhere the source is there. You need to find that out. The government has to take this very seriously, and the epidemiologist needs to find out where is the source of infection. The second thing is that people need to be aware of these kind of infections are circulating, and you need to create more awareness on these diseases so that people come in at a very earlier stage. And third is the government has to regularize the steroid use. That means now patients are using has been prescribed steroids left, right, and center, even without the protocols. And the steroids is recommended in some of the government guidelines itself. So all that needs to be withdrawn. It needs to be streamlined so that people are not given steroids unwantedly and not given any immunosuppression therapy in the name of cytokine storm. So we need to choose the patients best who needs it, and the government has to take steps with this. The fourth thing is that the government needs to make sure that there are adequate drugs which are available for this treatment. The supply and the demand mismatch should not happen. So they have to keep up the demand. They need to make sure there is a seamless flow of these drugs to the patients who require them and complete the treatment and stop, so that we can save as much as life as possible. So these are the recommendations which the government needs to do, and they need to do a massive surveillance on where it is, how many patients are affected, and from where these patients actually come from. Because we see that these clusters are also there in some of the areas. So we need to find out where these clusters are coming from. So that is how we are going to get past this infection, and that is what the government needs to do right now.
And finally, doctor, what are some remedies that people can follow by themselves to avoid getting this fungal infection?
The best thing is to keep yourself hale and healthy, have adequate, healthy food, and make sure your diabetes, especially your diabetes and the other diseases, are under control. Make sure that you don't continue steroids for a prolonged period of time. Please keep in track with your physicians, because some people, they are being prescribed steroids initially for severe COVID, and then they continue to take those medicines without the advice of the primary care physician or the COVID physician. So you need to keep in touch with your doctor and try to find out where these, when it needs to be stopped, how it needs to be continued. And the same way, you need to watch out for any of the kinds of mucormycosis symptoms and report to your doctors as early as possible, because it is completely curable, reversible, and treatable at a very early stage, and the mortality is very less.
With this, we'll conclude our interview, Doctor. You answered all the questions, and it was very helpful, informative and helpful discussion. Thank you so much for your time with us. Thank you.